The Northeast Development Commission (NEDC) is the focal organization charged with the responsibility of resettling, rehabilitating and reconstruction of the 6 Northeast states affected by over a decade of insurgency. The NEDC has been administered by the pioneer Managing Director Dr. Mohammed Goni Al-Ali. The rehabilitation and reconstruction of the Northeast has started in earnest. One other area where the people of the Northeast have felt the impact of the Commission is in the health sector. The NEDC, working with other stakeholders, has been in the forefront in providing routine health care to thousands of internally displaced people living in IDP camps in many of the Northeast states. One noteworthy example of NEDC interventions was the outreach it sponsored in partnership with Pro Health International, which was aimed at delivering emergency-free medical services to the people affected by the insurgency in Maiduguri and environs. Over 4,000 patients were consulted by a team of medical professionals, and these range from general outpatient consultations to surgical interventions. 98 surgeries were performed. 168 eye surgeries were done in addition to hundreds of laboratory services. Following a resolution by the governing board of the NEDC, the Managing Director, Dr. Mohammed Goni Al-Ali, swung into action with several initiatives and interventions to limit the spread of COVID-19. One of the first interventions was sensitization of residents of communities and internally displaced people living in camps in order to create public awareness on the dangers of the disease. The pandemic revealed a huge capacity gaps in the health system. The NEDC procured and distributed health sector equipment and consumables for protection against the virus. Thousands of hand sanitizers, face masks, infrared thermometers, personal protective equipment (PPEs), ventilators and ambulances were donated to the 6 states. These supplies were shared between host states and federal tertiary institutions based in those states. Federal tertiary institutions in the Northeast play complementary roles in the provision of health care, as well as training and retraining of health students and other personnel. So, NEDC donated ambulances, hospital beds, and solar refrigerators to 8 federal hospitals in the region. One of the national responses to curb the spread of the novel virus was a lockdown of cities, which strictly restricted movement of people and goods. The NEDC provided food assistance to communities through the state governments to cushion the effect. The NEDC completed the establishment of 2 advanced health facilities in Maiduguri. The 20-bed facility at the Muhammadu Goni Stadium, where thousands of IDPs were living, was fully equipped to handle COVID-19 cases. So is the Muna Garage IDP camp, also in Maiduguri, where a 30-bed facility was established. After the pandemic, these facilities are capable of being converted to intensive care units by the state government. Continuing with its interventions, the NEDC has comprehensively equipped the molecular laboratory in Bauchi, which has been certified by the Nigerian Center for Disease Control (NCDC). The NEDC has also equipped the molecular laboratory in the Federal Medical Center, Yola. In Taraba State, the Commission has fully equipped the Infectious Disease Laboratory in Jalingo, which has been commissioned.
The Northeast Development Corporation, to the glory of God and to the service of mankind. Amen.
These and many other critical interventions in the health sector are located in each of the 6 states of the Northeast. The NEDC, in conjunction with the Borno State government, has already flagged off the campaign for free fistula repair for 100 women in Maiduguri. The women are expected to be monitored for 12 weeks to ensure complete recuperation. The NEDC has a master plan for the development of the Northeast region. This master plan is the meticulous initiative of a team of experts steered by an astute administrator, a visionary strategist, a workaholic, and a conscientious son of the Northeast, Mohammed Goni Algali.